Hello, listeners. Maddie Miles here, and welcome to my first episode of my podcast series, What the Health is Going On? This series is going to be my project, specifically about my home state, Kentucky. A little bit about me: I'm entering my 20s now. I'm a college student at the University of Kentucky, and I will work in healthcare when I graduate. I've taken many chemistry and biology classes. I can explain the way a virus hosts itself in the human body, and I can even explain the chemical makeup of certain drugs. But a few months ago, I could not even begin to tell you anything about health law or policy in the state that I've lived in for my entire life. When I thought about my goals as a healthcare leader and professional, I thought about how little I knew about the state of healthcare in Kentucky. My eyes were open when I took a health law class my sophomore year of college. As I entered junior year, I realized working in medicine is only a fragment of what it takes to be a driving and powerful force of healthcare. So I'm researching to literally get with the program. I want to be able to lobby for things I believe in, and I want to make informed choices when I vote. And most of all, I want to lead Kentucky to a better and brighter future in healthcare. And if you're still listening, then hey, I've got your attention and we can totally learn this healthcare thing together. Now that I've gave a small introduction, let's kick off this episode's topic. What I want to do is pry into the biggest healthcare problems in Kentucky and see how the public views health. Then, as this series goes on, in future episodes, I want to see how government and legislation line up with helping fix these identified issues. Like, if the bills and laws being passed are really in our best interest. But we'll save that for next episode. If people don't know what is killing them, then how do they know what they should vote for or lobby for? Public knowledge is really important here. Does Kentucky know its greatest laws when it comes to being healthy? So I looked it up. When I visited the Foundation for a Healthy Kentucky website, I decided to look into their research. One of their research tabs was something called KHIP, like KHIP. It's an acronym for Kentucky Health Issues Poll. So they literally went around and interviewed adults in Kentucky and asked them the same open-ended question. What is the most important healthcare issue facing men, women, and children? And honestly, the people that answered didn't do bad. In fact, the majority almost answered perfect. People stated obesity as the number one health issue with children. As of 2015, nearly 19% of high school teenagers were obese. According to the Kentucky Institute of Medicine, quote, only 10 of Kentucky's counties are above the national average for physical activity and 78 are above the national average for obesity, unquote. Okay, so there are 120 counties in Kentucky. And you mean to tell me that 65% of those counties are more obese than the national average, and that only 10% are doing better than the national average for exercising? Those aren't good numbers. For men and women, the top two health issues identified were cancer and heart disease. And surprise, those are the leading causes of death for men and women in the state of Kentucky. Reading from the Kentucky Institute of Medicine, quote, cardiovascular disease is the leading cause of death in Kentucky. There are 113 counties with rates above the national average. Kentucky's cancer death rate is above the national average, with 112 counties having rates above the national average, unquote. Okay, so keep in mind, there are literally only 120 counties in Kentucky. Only 7 of them aren't above the national average for cardiovascular disease, and only 8 are not above the national average for cancer. Just let that sink in. Our entire state is being taken over by cancer and cardiovascular disease. Another really interesting thing from the Foundation for a Healthier Kentucky KHIP study is that answering problems with health insurance as a healthcare issue facing Kentucky nearly doubled this year compared to the same exact study done in 2010. It was identified second behind obesity for children, and it was identified third behind heart disease and cancer for adults. So, does insurance just suck more now, or are people catching on that insurance has always been terrible? Let's sum it all up. Kentucky adults understand and know that there is an issue in this state. They answered correctly when asked what the major health issues were. So now that we know that, do our healthcare bills that are being currently passed reflect this? I'm really interested to find out, or else this state is going to have no one left with a working heart or set of lungs. With all the tobacco use, drug and alcohol use, and physical inactivity, something has got to give. Until next time, I'm Maddie Miles, and thank you for listening to my podcast, What the Health is Going On. Special thanks to the Kentucky Institute of Medicine, Kentucky Legislator Online, Foundation for a Healthier Kentucky, and my amazing mentor, Dr. Sarah Kirksmar. Be sure to tune in for my next episode to talk about health law and policy.